April is Autism Awareness Month, so today we have Dr. Harris with us from Nationwide Children's Toledo to talk more about the disorder and what parents need to know or look out for. You know, it's so scary having a child. The childbirth itself can be just excruciating. Maybe threats to your mother, threats to the child. Then, everything's fine. The kid starts growing up. Then you start noticing some things. What are some of the early signs that you might notice with a child, and how early do you notice them?
That's a great question. I think the important thing to note is that autism symptoms present differently from child to child because each child is unique.
Yeah.
However, some of the things that we commonly see is difficulties with communication. So that may be a speech and language delay, difficulties having back and forth communication, requesting, expressing their wants and needs. When you think about social interactions, maybe they aren't wanting to socialize with their peers, or they have that social interest, but don't really know how to navigate social situations. And then you may see some presence of restricted interest and repetitive behaviors. So this could vary, but could include hand flapping, body rocking, walking up on toes, when playing with toys, playing with them in an atypical way.
And this could happen as early as like a year old, possibly?
Absolutely, and the piece, again, to note is every child is different. So for the symptoms, we can test down as early as a year, but some kids we don't catch until 2 or 3 once social demands become more increased, and then those deficits become more apparent. So it really varies for the children.
So what is autism spectrum disorder? And I know it's a spectrum, and so I know there's the extremes, there's also the Asperger's, there's a whole high functioning type, which makes it even more difficult to evaluate.
Yes, so autism is a neurodevelopmental disability characterized by deficits in social communications and social interactions, as well as that presence of restricted and repetitive patterns of behavior. And depending on the degree of autism, that just really tells us the level of support that your child might need if they're diagnosed.
So what are some methods to treat it? Now I know Mercy and Nationwide Children's Toledo has a facility there on Briarfield, and I know I was there when they were just building it and expanding it. I was there, gosh, maybe 3 or 4 years ago. I'm sure they were multiplying in the space there. And I know from seeing what they have there, there's so many different rooms and so many different things they can do. And I've heard some great feedback from parents who took their kids there.
Actually, touring that facility was a big draw of why I came to be the director of psychology here in Toledo. The facility is so great there. We get to see so many different children, but the biggest piece in terms of treatment is just trying to get earlier intervention as soon as possible, and then looking for interventions that have research that shows that they're beneficial for your child. Behaviorally based, developmentally appropriate. This can include applied behavior analysis therapy or ABA therapy, speech therapy, occupational therapy, social skills training. There's no one perfect package. It's really trying to find that therapeutic approach that's gonna best fit your child individual needs. And I really encourage parents to really be the advocate for your child to figure out what does that look like, but again, go with things that have been proven to be effective, which is based on our literature.
I know from just stories I've done with families for Acoustics for Autism, one child this past year discovered, he started playing some tennis and started playing the drums, and the drums, what a great vehicle. We all would just love to sit there and just pound on something. It's just a good way to vent.
Yes, and I say if that's something that keeps your kid happy, you by all means really just tailoring treatment interventions that are developmentally appropriate, that are teaching that new skill acquisition, and working on social interactions as well.
You talk about the parent being an advocate for the child. So the child doesn't seem to be behaving like other kids are. They're showing some. Get them into a doctor, get them evaluated. And then what's the next step?
Get them into the doctor's office, get them evaluated. In some cases, a diagnosis might not be apparent at that time, but at least by getting them in, they're on a professional's radar so that we can monitor their development over time to see if that diagnosis becomes warranted. Once that diagnosis is warranted, work closely with your medical team to be able to identify what is our next step, what are our treatment options. And again, I tell parents, you are the expert in your child. Nobody's gonna advocate for your child like you. Work with your medical partners to figure out what the options are, and then make a decision. And sometimes we don't always make the right decision, and we can come back to our medical partners and go from there.
We have information here about a way to get a hold of the Mercy and Nationwide Children's Hospital Toledo Autism Center. That's on Briarfield Boulevard there in Maumee, right by the expressway. And should they call that number? Is that the thing to do to get an appointment to come down and get evaluated?
Yep, they can call that number or even have their primary care provider or pediatrician place the referral to our office.
You know, you get a child, if your child's diagnosed with not Alzheimer's, with
Autism.
Asperger's. I'm sorry, I drew a blank there. Asperger's. They're high-functioning children, and they're high-functioning adults. They can drive, they can live on their own. There are circumstances where they can have and other than being a little quirky, they're just a joy to be around.
Absolutely, and I tell parents when we diagnose, I don't have a crystal ball. I cannot tell you the outcome of what your child will be doing in the future, but our hope is that through early interventions, we can get them set up for the best life possible for them, and that looks different for every child.
Doctor, you're so right, because all you want for your child is to be happy.
Absolutely,
and
absolutely.
Thanks to people like you, you can help make that happen.
Well, I'm happy to do it. I wake up every day to do it, and I love what I do. It's so rewarding.
Thanks so much for being here.